Welcome to our channel, where we are passionate about sharing information on health and wellness. In this video, we will be discussing a crucial topic that affects millions of people worldwide: heart failure. We will be exploring the latest treatment options and sharing tips on how to manage this condition for a better quality of life. So, if you or someone you know has been diagnosed with heart failure or is at risk, be sure to stick around for some valuable insights. Is your heart doing well with all this pandemic stress? Today I'm going to talk about the 10 signs that your heart may not be well, and what you can do if you have any of these signs or symptoms. Heart failure affects any age group, and about 2% of the US population has some degree of heart failure, which means almost 5 million Americans. In addition, as the final route of all damage to the heart, it increases with age, with more than 10% of these elderly people affected after the age of 70. That's why this topic is so important. I'll try to answer the most frequent doubts about heart failure. What is it? What causes heart failure? What are the risk factors? What are the types of heart failure? And finally, the most important part, what symptoms you should be worried about and what you should do if you or any of your family members are experiencing any of these symptoms. So, don't miss it. Stay until the end. What is heart failure? Heart failure, also known as HF or CHF, occurs when the heart muscle does not pump blood the way it should. All the cells in your body depend on this heart pumping to receive oxygen-rich blood and nutrients so that the body can function normally. Therefore, it is essential to pay attention to your heart health, especially during these challenging times. By taking care of your heart, you can also take care of your overall well-being and reduce your risk of developing heart problems. So, don't wait any longer. Start taking care of your heart today. How does a healthy heart work? A healthy heart is a muscle that continuously pumps blood through your blood vessels. The heart has 4 chambers. The 2 upper chambers are called atria, and the 2 lower chambers are called ventricles. The right atrium receives oxygen-poor blood from the rest of the body and sends it through the right ventricle to be oxygenated in the lungs. The lungs perform the gas exchange, and the oxygen-rich blood travels from the lungs to the left atrium, then to the left ventricle, which pumps it to the rest of the body. Therefore, the left ventricle is the most crucial part of the heart, as it must have the strength to pump blood to the rest of the body. Understanding heart failure. In heart failure, the heart muscle is unable to pump enough blood to meet the body's needs. Initially, the heart tries to compensate for this by dilating the left ventricle. The heart dilates to contract with more force and pump more blood. Over time, this weakens the heart. In some cases, the heart may not dilate but instead thicken its walls, becoming muscular, as in hypertension. This is also harmful. Imagine a pot that holds a liter of water. You decide to pour cement into the pot. After drying, this pot will no longer hold a liter of water. Similarly, over time, this heart may dilate. Another way the heart can compensate is by pumping faster, causing the person to become tachycardic, to increase cardiac output. The body also tries to counterbalance in other ways, such as blood vessels narrowing to maintain high blood pressure, attempting to compensate for the loss of power from the heart. Finally, the heart becomes weaker, and heart failure worsens until this compensation no longer works. This is when the person will experience the symptoms more intensely. It is crucial to understand how a healthy heart works to appreciate the severity of heart failure. As heart failure progresses, it becomes increasingly difficult to treat, and it can ultimately lead to severe health consequences or even death. Therefore, it is vital to take care of your heart health by exercising regularly, eating a balanced diet, and avoiding behaviors that can lead to heart disease. What are the causes of heart failure? Heart failure is often caused by other medical conditions that impair or overload your heart. Acute heart failure can be caused by myocarditis, which is inflammation of the heart muscle. COVID can cause myocarditis, as well as injury that damages your heart, such as a heart attack or pulmonary embolism that overloads the right ventricle that pumps blood to the lungs. Chronic heart failure is the most common and typically occurs on the left side of the heart. In addition, there are 2 types of left-sided heart failure. In heart failure with reduced ejection fraction, the left ventricle of the heart is weak and unable to pump enough blood to the rest of the body. Causes such as heart attack or coronary obstructions can lead to this. Other causes include valvular heart disease, such as mitral regurgitation, aortic regurgitation, congenital heart disease, alcohol abuse, and Chagas disease, which is very common in Brazil. In heart failure with preserved ejection fraction, the left side of your heart is too stiff to fully relax between heartbeats. It's like cement in a pot, it can't have the correct volume of blood to eject to the rest of the body. Causes such as hypertension, diabetes, and obesity fall into this category. What are the risk factors for heart failure? Many factors can increase the risk of heart failure. Some factors you can control, while others you cannot, including your age, genetics, infections such as myocarditis that increase the risk of heart failure, obesity, hypertension, diabetes, sleep apnea, chronic kidney disease, anemia, hyperthyroidism, hemochromatosis, iron overload, and cancer treatments such as radiation and chemotherapy that can damage your heart and increase the risk. Other factors include atrial fibrillation, alcohol abuse, and coronary artery disease. How is heart failure diagnosed? Echocardiogram is the most effective way to diagnose heart failure. It can identify the strength of your heart, how your valves are functioning, the size of your heart, and the thickness of your heart muscle. A blood test is also useful in identifying whether shortness of breath is due to heart failure or lung problems, which is BNP. BNP is a substance secreted by the heart. Blood levels increase when heart failure symptoms worsen and decrease when heart failure is controlled. What are the 10 symptoms of heart failure that you should be concerned about? The first symptom you should be alert to is shortness of breath or dyspnea, especially when you exert yourself or when you lie down. People begin to use more pillows to try to sleep better. You may think that fatigue during exertion is due to age, but sometimes it is not. The second symptom you should pay attention to is rapid or irregular heartbeat. As I mentioned earlier, the heart tends to increase the heart rate to pump more blood, causing tachycardia. Also, a person with a dilated heart may have arrhythmias, such as atrial fibrillation or even extrasystoles, which are missed beats. We have several videos on our channel about arrhythmia. It's worth checking out. The third symptom, persistent cough or wheezing with white or pink phlegm. This means that there is fluid in your lungs, in your alveoli. It's important not to ignore this cough. Fourth symptom, you wake up frequently at night to urinate, which we call nocturia. This can be due to the person retaining more fluids as their heart and circulation are not functioning properly. So, at night, this excess fluid needs to be eliminated. Fifth symptom, rapid weight gain. Also due to fluid retention. The kidneys are less able to eliminate sodium and water, causing fluid retention in the tissues. Sixth symptom, swelling in the ankles, feet, legs, abdomen, and neck veins, jugulars. I have already made a video about leg swelling, and heart failure is one of those causes of edema. The ankle becomes puffy, like that bread that is baking. When you press it, it makes that dimple, that sign of pitting edema. In right-sided heart failure, such as in Chagas disease, we often see swelling in the abdomen, with difficulty even eating, as a result of ascites. Seventh symptom, inability to sleep lying down. The person has to sleep in a chair or also wake up suffocated at night, which we call paroxysmal nocturnal dyspnea. Eighth symptom, generalized weakness. Feeling tired all the time and difficulty in day-to-day activities such as shopping, climbing stairs, carrying groceries, or walking. The heart cannot pump enough blood to meet the needs of the muscles and tissues of the body. The body redirects blood from less vital organs and sends it to the heart and brain. Ninth symptom, loss of appetite, nausea, feeling full, or having a bloated stomach. Why is this? Either the digestive system is edematous, swollen, or the digestive system receives less blood, causing digestion problems. And finally, the 10th symptom, mental confusion, impaired thinking, memory loss, or a feeling of disorientation. The alteration of levels of certain electrolytes, especially sodium, can cause confusion. But also, low cardiac output, the lack of pump, can impair blood flow to the brain. Overall, it's crucial to pay attention to these symptoms as they can be signs of heart failure. Seek medical attention if you experience any of these symptoms, especially if they persist or worsen over time. Don't ignore your body's warning signs, and take care of your heart health. What are the treatments for heart failure? Today, fortunately, we have many medications that can improve the strength of the heart and also alleviate symptoms. There are more treatment options available for heart failure than ever before. When I was an intern just over 20 years ago, we had few effective weapons for heart failure. It's incredible how rapidly cardiology has evolved since then. In addition to medication, lifestyle changes are necessary, such as reducing salt intake and sometimes limiting fluids. In advanced cases, we may consider a cardiac resynchronization device or even a heart transplant. The goals of treating heart failure are primarily to slow the progression of the disease, reduce symptoms, and improve quality of life. It's crucial to detect heart failure as early as possible for the best outcomes for you and your heart. Don't wait until it's too late, take control of your heart health now. With the many available treatments and advancements in cardiology, there's no reason to suffer from heart failure. Seek medical attention at the first sign of trouble, and work with your healthcare provider to develop a personalized treatment plan. Your heart deserves the best care possible, and it's up to you to make it happen. We hope you found this video informative and helpful. If you did, please don't forget to subscribe to our channel for more informative content on health and wellness. We also encourage you to leave your thoughts and opinions in the comments section below. If you have any questions or concerns about heart failure or any other health-related topic, please don't hesitate to reach out to us. Thank you for watching, and we'll see you in the next video.